Hey guys, welcome back to the Impetus Health Podcast. I am joined once again by Dr. Lauren Potter, and this is the episode that we were alluding to last week. If you were listening in, episode is all about the pelvic floor, and we're going to dive into women's pelvic health and ask a specialist what she knows about it. So this is going to be I'm going to learn a lot, and hopefully you guys will too. So we'll get into it. Lauren, thanks again for being on the show. Appreciate it.
Absolutely.
All right. So women's pelvic health. This is such a deep topic. There's a lot to get into on the lighter side and on the heavier side. So we'll try to dabble in both realms a little bit today. But right off the bat, I guess I could ask, why do women need pelvic health therapy?
Ooh, there are so many different reasons for that. So really, I would say for a lot of women, it comes down to whether you have generalized pelvic pain. If you are the person who says, oh, I just have to pee all the time. You've got a lot of frequency. You have urgency when you need to go. Or if you are the kind of person who only wears black leggings to the gym because you don't know when you're accidentally going to leak a little bit. Those are all big things that these patients can benefit from pelvic floor physical therapy.
So clearly, I'm not a woman and I don't understand some of this. So go into some of those for me. So generalized pelvic pain. What is this exactly? What could be the causes of it, and what are some of the remedies that we have?
So there's lots of different causes for pelvic pain. So it can go to the point where someone has endometriosis, if they have an interstitial cystitis, so more so an inflammation of the bladder. Sometimes people just have pelvic pain and we don't really know why. There is no medical answer or medical source to why the pain is there. There are certain conditions that, an example of with endometriosis, people have lesions that I can't actually take away and I can't fix those with physical therapy. But what I can do is I can help to work on the muscle imbalances. So work on their hip strength, work on that pelvic floor, and actually get them exercising. So in the cases where there's a medical condition that I can't take away, if we just get someone doing exercise, that analgesic effect is going to help reduce the discomfort that they have alongside the medical treatment that they're receiving as well.
That's great. I think that's so true. We talked about this in the last episode a little bit, is that women's pelvic health therapy is not this alien thing. It's something that we understand. We have a good understanding of it because it's not this thing out in left field. It goes along with everything else that we know about the body quite well. I always say, and anytime I speak, that the fundamental movement principles that we have and know, they translate across every single movement and every single thing that we do, which is beautiful because that helps us to make sense of things that seem rather foreign. And this is not foreign. So I guess on that side of things, let me ask you this. What is the pelvic floor? So we probably need to describe what the pelvic floor is before we can talk about it. So.
Absolutely. So the pelvic floor are the muscles that are sitting right inside of the pelvis. So they're the bottom part of the core. So our core is making up the pelvic floor sitting at the bottom. We have the abdominal muscles on the front, the diaphragm at the top, and then all of our erectus spinae, the spine, everything sits as the back side of our core. So the pelvic floor muscles are what are actually helping to support our organs. Males and females have them. It's just that the overall anatomy and surrounding kind of looks a little bit different.
Yeah, and I do want to touch on strengthening the core and some of that really in a functional way, and touch on what you said before a little bit is like I may not be able to help this particular issue from just like let me do something quick and help it, but the strengthening side of things tends to always help no matter what it is, because I like to give this analogy. If pain is icebergs, so you have the icebergs coming up, and then our resilience, our strength, our power is the water level. The higher you can get your water level, you can cover up some of these painful issues. The issues are still there. It's just that your body is far more resilient to it. So you start getting weaker and less endurance, those water levels drop, and you start seeing the tips of the icebergs more. And I think it's probably true in scenarios like that where we can't quote unquote fix it, but we can do a lot of good with it because we can get you stronger.
Absolutely. That was a great analogy for it.
Yeah. Okay. So on the pelvic health side, so generalized pelvic pain, and then you spoke a lot about the incontinence side of things. What does that look like? And is that common? Is it rare? What do we see?
So that looks like whether a little bit or a lot of leakage whenever you are jumping, sneezing, doing resistance training. It can even look like, hey, I feel like I have to go, but I can't make it to the bathroom enough, and I actually leak before I even get there. So there's very different ways that it looks. A lot of times people try to normalize it and say, oh, well, I pee every single time I jump, but that's normal because I had 5 kids. It's not normal, and it's not something that we should just accept. If you are in a scenario where you only wear dark colored leggings to the gym because you want to be able to cover up any kind of leakage, you shouldn't have to live that way, and you shouldn't have to always have that fear. So pelvic floor physical therapy can absolutely help with that, because the source of the incontinence is what we would find in the exam. So sometimes it comes down to those pelvic floor muscles just in themselves being weak. It can also be hip weakness that can even lead to that too. So if you think about at the gym, when you're doing all this activity and your muscles are fatiguing, the hips and the hip muscles and the pelvic floor muscles, they're sitting side by side in the pelvis. So if there is a weakness or a muscle incoordination, a muscle dysfunction in one of those, likely we're going to have a dysfunction in the other one too.
Absolutely. And I think we understate the compensatory actions that occur after having a baby. Would you categorize childbirth as trauma?
Yes.
I think absolutely. And it's funny, not funny at all, but it relates to the other people that we see who have traumatic injuries. So if I have somebody who has a rough car wreck, or someone who has something traumatic happen, the body has a state of shock to it. So all of a sudden we have been given this great gift in this child, and we give birth, and all of a sudden the body is in shock. The pelvic floor itself is shocked. So not only do you have just the actual physicality of it, to where things are being stretched out dramatically, like you're really going through some trauma in that moment. So you're having the weakness produced from that, simply from this massive overstretch, which was several times results in tearing, obviously. But also you have this shock factor where the body does not know how to respond to this. And if we don't, quote unquote, turn things back on, they might come back a little bit, but there's no incentive for them to fully come back. So I think that's part of what we do on the PT side, especially what you do, is we're allowing the body to do what it was meant to do what it was supposed to do. We're kind of reteaching it to do those things. And I can't help but think of coordination when I think of the pelvic floor. Am I in the right realm of coordination?
Absolutely.
Yeah. So what does that look like after that? What are we actually retraining? How are we doing this?
So it looks different. So for some people, they are going to have a lot of weakness in the pelvic floor muscles after delivery. And that can be because the muscles went through a lot. Like you said, you had some kind of trauma. It's the same as if we have a knee injury or a knee surgery and there's a trauma to the knee. So the quad shuts down and we have to teach that quad how to start functioning again. Same thing with the pelvic floor. So when you've gone through something like childbirth and there has been a trauma to those muscles, they sometimes need to be taught how to start functioning normally again, and how to start coordinating properly with exercise or just with general daily activities. And additionally, though, when you're pregnant, there are changes happening all over the body. So there's things going on even in the hips that we can look for in physical therapy, and that can be muscle weaknesses that are present. And so, like I said, when there is a muscle weakness or some kind of incoordination between the hip too, we're going to see something occurring in the pelvic floor muscles too, whether that is a weakness or a tightness or both, really.
So what are some of those changes, like in the hip that you're talking about? What are some of those changes that are undergone pre and post having a baby?
So your body's preparing for delivery. So while you're pregnant, your body's releasing a lot of the hormone relaxin too. So the pelvis is actually moving. Delivery in itself, especially if you heard it's a vaginal delivery, it's forceful. Like you are having to push really hard.
Yeah.
And so those muscles are going through so much. You're put in positions that you're not used to being into. And so sometimes what can happen after that is the muscles kind of forget how to jump back in that rhythm and actually function properly.
That's good. So what would be some, if they're not coming back into rhythm, what would be some symptoms of that? I know leakage is one. What are some other symptoms?
So it could even just look like general pain. So if there is that incoordination in muscles, you may have pain with activities that typically wouldn't be painful. Whether it's exercise or suddenly intercourse is painful when it wasn't before. So yes, the leakage, potentially frequency, or just suddenly having the urge to have to pee all the time when that wasn't present before too. Those are some of the things that can factor in.
Is it like a hypersensitive thing? Like, I mean, like when you mentioned like the pain with intercourse afterward, is that a sensitivity issue? Is what's going, I mean, we may not know, but what do we know about that?
So it can be just like any other muscle in the body where you can get tissue that's just tight. And sometimes when there is a tight or like a knot in the muscle too, that in itself can be tender and painful. Sometimes though, when we get the muscle tightness, it's because there's a weakness present. So when the muscle doesn't know how to function properly and it gets tight because it feels like there is a weakness, we have to teach it how to have strength through its full range of motion to help kind of alleviate that tenderness and the tightness.
That's good. And I think that's can be confusing for a lot of people. Whereas if you have a hyperactive muscle, a very tight muscle, for me in my world, I think of the hamstrings quite a bit. The hamstrings seem to always be tight. Well, when I think of a tight muscle, I think, okay, then it's maybe it's just stronger. Maybe it's just a stronger muscle and it doesn't have, I don't know. I think most people think along those lines, but that's not really what we're seeing with hyperactive muscles. They tend to be quite a bit weaker. What do you see, I guess, on the hyperactive side, how do you try to work on that from the pelvic health perspective?
Trying to get someone to activate that muscle through the full range of motion. So sometimes when it's tight, it's because it doesn't know how to activate in an elongated position. So trying to get them in a position where we know that the pelvic floor muscles are going to be elongated and stretched, and getting them to actually activate the muscle there too, so we can re-educate it how to start working properly and kind of getting it back in sync.
Yeah. What are the biggest challenges for these women who, and I'm speaking particularly to women who are having pelvic floor issues after giving birth? What I know we talked about the leakage, but what are the challenges they're facing overall from just the healthcare system that we're in to maybe they're trying to get back into fitness and working out? What are the things that they're facing? Because I don't know. This is definitely I don't even know on the healthcare side if there's enough good education out there. If there's enough primary care physicians, if there's enough people giving them I don't know what the space looks like as far as are there OBs telling them, okay, you need to work on your pelvic health control and your pelvic health therapy. Is this common? Is it not common?
So it's really, I can't speak from a personal scenario because I haven't been pregnant yet. So something there, like a lot of things that I keep hearing from patients and people that I talk to, and even stuff that I've been researching and looking up, is I would say the big thing is that for so long it's been normalized that
you're going to have these issues.
Yeah, like, hey, you leak, you have pain, you feel like you can't jump back into exercise, or when you do, your hips hurt. That's just happens because you had a baby.
Gotcha.
So I feel like that's a big thing for so long, pelvic physical therapy wasn't as commonly talked about as it is now. So things just people got used to, I accept it and I just kind of keep moving on because there's nothing I can do about it.
Yeah.
So I'd say there's that side of it. In some scenarios, I would say that some physicians haven't been fully educated on the benefits of pelvic floor physical therapy. So they don't know how to properly even tell their patients, hey, this is an option for you.
Yeah.
The other thing too, I'd say that you have a new baby. Mamas don't really have the time to prioritize themselves too. So things kind of get pushed off and prolonged. And then the longer we're prolonging, the more you just kind of accept it as, it's my new normal. It's okay. Yeah. So I think that's gonna be a big factor as well.
That's a good point. Okay, so let's flip the page a little bit and let's talk about the women who haven't had a baby and they're having pelvic health issues. And I guess right off the bat, because again, I don't know this, are the same amount of women having pelvic health issues who haven't had babies that are who are having pelvic issues who have had babies, or is it a different ratio?
I would say it is. It's really? There's really. You can have pelvic floor issues or pelvic floor dysfunction and have never been pregnant. And there's many things for that. I would say some of it comes into poor habits around like toileting and bladder function. So a lot of that comes into, especially in my generation growing up, where I was told that the toilet seat's disgusting and you can't ever sit on it unless you're at home. So everyone always kind of hovers above it a little bit, which seems silly and it seems like it wouldn't be a big deal. But there's a neurological loop from the bladder to the brain that says when I sit and I'm about to urinate, the pelvic floor muscles relax and then the bladder contracts. The pelvic floor muscles, we have control over when we contract them or not. The bladder is an involuntary control. So it's not till we sit and we tell the brain, hey, I'm ready to go, that those muscles are supposed to relax and then the bladder contracts. If we're always hovering though, those pelvic floor muscles are staying contracted while we're urinating. And that may not seem like a big deal, but if you think about over time, all the years this has been happening, that's going to cause a dysfunction. And those pelvic floor muscles are contracting in a time when they really shouldn't be. So that plus people being in a hurry and trying to like power pee to get back to work really quickly. Kind of more on the tactical athlete side of it, I'd say that's something I would hear a lot in potentially like a first responder or even on teachers too. Like you're in a moment where you can't really take time to yourself, so you got to get in and get out really quickly. So that power peeing, like trying to go really quickly, even it sounds funny, but you're contracting the pelvic floor muscles to try to assist with urination, and that's not what they're supposed to be doing.
We've confused that pattern then.
Absolutely. So that is why I would say there's still a lot of pelvic floor dysfunction, even in females who've never given birth.
Gotcha. So for those ladies, is it more? What are some of the things that we're seeing? Is it a hyperactivity, of the area? Is it a frequency thing? Is it like what are they seeing? Hey guys, if you are listening to this conversation with Lauren and I, and you are thinking, this is me, I need help with this. I have pelvic floor issues, and I think this could really help. Reach out to us. We have a whole division of our company is Vulcan Pelvic Health Physical Therapy, and we do exactly the things that we're talking about. Lauren is our specialist in this. She focuses entirely on the woman's needs when it comes to this particular field, and she does a great job of it. She can help you avoid some of the things that we're talking about. How do you become less frequent? How do you stop the leakage? If you're having pain, we can do a lot of stuff with that. So if you have questions about this, please reach out to us. I will put the link in the description of how to get in touch with us as a physical therapy company. And then once you reach out, we'll give you a call. Lauren may even call you herself, and she'll walk you through what to expect and how we're going to go about helping you. So if you have any questions about this, Lauren's information is also in the description. Please reach out to us and we'll do everything we can to help you. Thanks.
Combination. So it is more so of a urinary frequency, and some of that comes from that dysfunction between the bladder, the pelvic floor, and the brain. So if I am trying to pee really quickly, or I'm hovering over the toilet and those pelvic floor muscles are contracting, my bladder may not be able to empty all the way. And when that happens, then I'm going to feel like I have to go more often because it is filling up a little bit more. And so because the bladder can't completely empty, it's kind of throwing off that signal to the brain that the bladder doesn't really know when it's full. So then there creates a sense of urgency and thinking that maybe when it's a quarter of the way full that I have to go now or I'm going to have a problem. And so it just further throws off that neurological loop. And then it also just kind of makes it where you do have that urgency all the time.
Yeah, man. Yeah, I can definitely see that. So okay, we've covered post-birth, pre-birth. What about the women who undergo some type of traumatic experience, whatever that may be? And let's talk about it in a way like let's talk about trauma that's not sexual in nature. So maybe a woman has a car crash, or maybe she is abused from like physical abuse, not sexual abuse, but physically abused. I'm sure that area is affected overall. What would be some things that do you think would still manifest in something like a frequency issue? Maybe, I guess it just depends on the trauma too. But I'm sure those women are seeing some issues as well.
So when you get into that realm of things too, it's always a tough subject to talk about too. And I would say that sometimes people who have had some kind of traumatic experience in general, they're uncomfortable to talk about what they've been through, and there might be some fear associated with even trying to get treatment. So that could be something where they've had pelvic floor dysfunction for years and never told anybody, never sought help because it's tough to talk about. But also, sometimes maybe they don't know that there's an option out there to be able to fix the dysfunction. So it can look the same though. So if you imagine like a car accident where there's everything kind of contracts quickly. So they've got some muscle tightness, some dysfunction going on. I would say it's something similar in that area too. I mean, they're muscles just like they're anywhere else in the body. It's just that we can't reach them as easily as we can everything else, but they can still have the same kind of response to trauma or to like something unexpected as any other muscle in the body.
So I guess from that going into the trauma that's more sexual in nature, what are some of these women experiencing afterward? Like what are they having to deal with just this trauma?
That kind of dives into a really tough topic.
Yeah.
So patients that have had a traumatic experience, it's going to be tough for them to want to seek out pelvic floor physical therapy because, again, it's something really tough to talk. It's painful to talk about. It's something that you have to be really careful in opening up about. So that's the thing that with a pelvic floor physical therapist, you really have to understand that even if you have someone coming to you because they're like, oh, I just pee all the time and have urgency, they can still have a traumatic history that kind of started the whole issue of pelvic floor dysfunction. And they may not actually want to share that with me. So yeah. I may never find out until I've even been working with it for a while and they feel comfortable enough to share it. So no matter who's coming to me for a pelvic floor exam, I'm asking a lot of, they're very sensitive questions in general.
Yeah.
But I'm having to be very careful in how I ask questions and how I even approach the exam in itself. Because with pelvic floor physical therapy, there is an option for an internal exam, but not everyone needs that. And not everyone I will choose to do it on too. So if there is some kind of trauma in the past, that's not someone I want to do an exam on, because that's going to be really tough for them to process.
Yeah.
And that's going to bring up some painful experiences too.
That's great. So the internal exam like that's not always needed.
No, it's not. I can get a lot of information just from hearing someone's history, from looking at their overall function, looking at their hip strength. So not every person's going to need that exam. And I may not even do it in the beginning. Sometimes I'm going to wait and kind of see how they're progressing and then say, okay, this might be something we should consider, so we can kind of get a better idea of your muscle function. Because with the internal exam, we're able to see, can they contract? And then what's the endurance like? That's something that it's really tough to get externally just because of where the muscles are seated. But it doesn't mean that every patient needs it.
So what goes into one of your evaluations? So when you have someone who you've never seen before, they're coming in for a pelvic floor evaluation, what do you try to look at each time for that?
So a lot of a pelvic floor evaluation is us chatting. So I'm going to ask them all about their history and kind of seeing how...
I think a lot of any good examination is chatting too. You've got to get a good subjective, or else you're not going to know what objectively is going on.
Absolutely. Yeah. So a lot of what I'm asking again are really personal questions. I'm asking about their bladder habits, about pelvic pain. So I'm asking about the frequency, urgency. We'll dive kind of into sometimes if they notice a pattern. So one thing I have my patients do is I have them do a bladder diary, which is really tedious and it's super annoying because for 2 days they're having to track what they're drinking and then how often they're urinating and if they have urgency attached to it. But I do that because then I'm able to look and I'm able to see patterns. So sometimes what can contribute to pelvic pain, urgency, frequency, and even incontinence with exercise are actual bladder irritants. So there are certain foods and drinks that we know can irritate the lining of the bladder. And when that happens, we're more likely to get all these other symptoms too. So that's my first starting point of how I can kind of look for those patterns is checking out their bladder diary. So what we'll see is, okay, whenever I have my coffee in the morning, I'm going every 30 minutes, but then the rest of the day I can go every 2 hours. So it's like, okay, well, that might be contributing to why we have some frequency at this time. So I'll educate them that, hey, I'm going to have you do this bladder diary. I know it's going to be annoying, but I tell them about that and kind of what I'm looking for. And then I really just go into just a general functional exam like we will for any other patient. I'm looking at how they move. I'm looking at their squat, their ability to do stuff in single leg stance. I'm looking at their hip strength, like total lower body strength. I'm looking at all that same kind of stuff that I would for any kind of orthopedic examination.
Yeah. What are some of those bladder irritants? I know caffeine is a big one. What are some other irritants that I just haven't thought of?
So coffee and tea, whether caffeinated or decaffeinated.
Really?
That one surprised me, but yeah.
That's interesting. Okay.
Yeah, I thought that was kind of unique. Carbonation, spicy foods, citrusy foods, or liquids.
You're kidding me. What? Okay. No, keep going. Sorry.
So spicy, citrus, sometimes tomato products, dairy, and chocolate. So those are the big ones on the list. And sometimes they're really tough to find because it may not be one of these kind of more well-known bladder irritants.
Yeah.
And just because they're on the list doesn't mean they're going to be aggravating to everybody, but those are the patterns you look for in the bladder diary. So sometimes if there seems to be a pattern in the bladder diary, we really can't see for sure what it is, then we're going to have them do it for a longer period of time and we're really trying to dive in and see what is this thing that's aggravating it? Because if we can get that irritant out of the way, then that can improve overall quality of life and reduce some of the leakage too.
Why the spices? Why citrus? Do we know why?
I do not have a good answer for that.
Yeah, that's interesting. I haven't thought about that. Or milk. Why?
They gave us, it was really interesting. There was an example that someone was having a lot of issue with incontinence. And it got down to the nitty-gritty details of it was red food dye. And when that went away, everything got better. So sometimes it's a very odd irritant that takes a while to figure out.
But it kind of tells you that's why a diary is required to figure out what's going on.
Yeah, and it really gives us a lot of information.
Yeah, man, that's crazy. Okay, so let's say you're done your evaluation, you're working with someone, and let's stick with the three common ones that you talked about: general pelvic pain, and really in leakage, and then frequency. So if they're going along in PT, what are you trying to do other than the diary to help them from a movement and exercise perspective? You probably are still talking about something to do with their diet. Maybe they're just, hey, how much water are you drinking today? Oh, I'm drinking 300 ounces of water a day. Maybe that's a frequency. Maybe that's something. But from an exercise perspective and what you're giving them to do at home, what are some common themes that you've seen?
So one note on the liquids, though. So dehydrating yourself can actually lead to more frequency and urgency because the bladder lining can get irritated just because you're dehydrated. So most people think that if I stop drinking water, it's going to go away. A lot of times we're having the opposite effect. But to answer your question, a lot of what my patients are going to be working on is in that exam, we're looking for what's weak and we're going to strengthen it. So commonly what I'll see with people that have a pelvic floor dysfunction is a lot of weakness going into hip external rotation. There is a strong correlation between focusing on the hip external rotators and having improvements in pelvic floor function. Nice. Same thing though with the core, just kind of working on some core strengthening, looking at their breathing patterns, all those kind of things are stuff that we're looking at in that exam. And really it's whatever I find is what they're going to be working on. So a lot of my patients will go home doing clamshells, doing squats, trying to get to full depth because they aren't able to contract their muscles at the bottom of a squat. And if we don't have good strength and control through that range, that's going to impact general muscle functioning. So.
Yeah, man, that's good. Okay, so what are, I guess on the pelvic health side, and we're getting ready to wrap this up. What are some common questions that women ask you? We've got a seminar coming up that you're going to be speaking at, and people are going to ask you a ton of questions. What are some of those questions that people are just asking you in general?
A lot of times people are more so surprised or curious at how physical therapy can help them stop peeing so much.
Wow. So
they're just kind of, it's more so curious of like, how is this going to help me?
Just not generally known.
Yeah. Most people have no idea that it can make an impact on it. So that's a lot of the question is, how's this going to look different? Am I just going to lay on the table and do Kegels all the time? Are Kegels bad to do? So those are really a lot of the questions that I would say I'm getting.
Answer it, please.
Sure. So everyone has always been told in the past that, okay, your pelvic floor is weak, just do some Kegels. There's more to it than that. Like I keep mentioning, the hips are a huge factor in pelvic floor muscle functioning. But also, just being told to do a Kegel, a lot of times people don't know if they're even squeezing their pelvic floor muscles. A lot of times when you say, hey, activate your pelvic floor, people are just squeezing their glutes. Yeah. Or they're squeezing the posterior side of the pelvic floor. We're missing the whole anterior side of it. So it's that, again, the muscle incoordination, the not knowing how to properly squeeze, that more so can make the Kegel something that's not beneficial. But then also there's the case of we have muscles that are tight because there's an incoordination there. And if I just say, just keep squeezing, well, that's not going to help to really teach it how to function through a full range of motion. Yeah.
I guess that kind of leads me on because, I mean, you are in this stuff, you're going to get into some sensitive topics for sure. Why should you not be embarrassed to have pelvic floor issues if you're a woman?
Because it's very common. And it's, if you have someone who has chosen to be a pelvic floor physical therapist, they did it knowing that it's a very uncomfortable and awkward thing to talk about. I love that. I don't know why, something about it drew me to it when I found out that pelvic floor physical therapy was a thing. I was like, I love being the person that someone can come to with a really awkward, sensitive topics because I don't mind having those conversations and I want them to feel comfortable. So you're coming to someone who knows that you're bringing all of your really embarrassing, sensitive topics and they're ready to chat with you about it.
They know how to deal with it.
Absolutely.
That's really good. I love that. This totally ran. I remember when I was growing up, I was around a very sweet lady and she would never laugh. She would try to not allow herself to laugh, and we never knew why until one day where she really laughed, and she's like, I'm going to pee on myself because I'm laughing so hard. And we didn't realize it, but she really, her whole life, she goes trying not to laugh because of that. So,
oh, man.
And it's something that gets a whole lot better, but you're right. Most people don't even know that this is something that you can do, which is sad in so many different ways.
Really is.
Yeah.
So I'm hoping that it kind of gets out there more, people know about it, and they realize that there is a way to get help and get relief from the symptoms that they've been dealing with. I mean, she is not the only one. There's people who are terrified to sneeze because they're afraid that if they sneeze, they're going to leak. They don't know how much, but they know they're going to leak. And that's not a great way to live. Pelvic floor PT is amazing because it can significantly impact someone's quality of life.
Yeah. Okay, we're going to wrap it up. We're going to ask Lauren one more question. If you have a piece of advice to give to any woman who's struggling with pelvic health issues in general, what would you tell them?
Come to pelvic floor physical therapy.
It's as simple as that. Just
Absolutely.
Come get help. Yeah, there's no reason. I'm not a mechanic. I can't fix my car. I'm going to take it to a mechanic to have it done. So I'm with you. Awesome. Well, Lauren, thank you so much. This has been super insightful. If you guys have any questions for Lauren, I will put her information in the description and in the chat box, and we can give you a way to get a hold of her. And again, guys, she's here to help, and we're just here to help. So we'll see you guys soon, and we'll probably have Lauren back again. We'll have some other pelvic floor guests coming on, so we got some good stuff coming. All right, see y'all.